All right. Well, welcome to the July 2025 session for the Rural Health Association of Utah's Rural Resource Webinar Series. This is a series designed to spotlight valuable resources that healthcare professionals across Utah may not know about. Our aim is to improve health outcomes by increasing awareness of these resources and encouraging the use of these tools and resources to help improve care. Recordings and material from each of the sessions will be available at RHAU.org/RHAU-webinar-series. As the series progresses, RHAU remains dedicated to developing a robust, on-demand resource library for individuals who are serving rural Utah. We are truly grateful for everyone who's registered today, for everybody viewing the recording. Your engagement means a great deal. We also want to offer a heartfelt thank you to the Intermountain Health Foundation for their generous support, which makes our series possible. The agenda for today is as follows. So we will have two presentations. The first will be from the RestoreD program at the University of Utah. That will be provided by Dr. Alex Terrill and Catharine Sparks. Our second presenter will be Gladys Chiang with Woodpecker Copilot. Each presenter will have about 20 minutes to present and 5 minutes for Q&A. You can put questions in the chat box. We're happy to answer those as we go, but we'll also have an opportunity to ask questions at the very end. So I'm going to move into the RestoreD slides. And our presenters today, Dr. Alex Terrill is a licensed clinical psychologist with extensive experience in stroke, quality of life, and rehabilitation. With over 15 years of experience in intervention development that uses community engagement research approaches. She has been continuously funded by the National Institute of Health. Dr. Terrill's research interests were inspired by the inherent resilience of patients when they face a life-challenging injury or illness, and the recognition that recovery was influenced interpersonal as well as social and environmental factors. For the majority of her career, she has focused her research on understanding what helps patients adapt to and cope with disabling conditions, and translates this into interventions that support patients and their care partners, especially those who live in rural areas and may have limited access to mental health support. Dr. Terrill holds joint appointments in the Department of Occupational and Recreational Therapies and the Department of Physical Medicine and Rehabilitation at the University of Utah. She's also the co-director of the Center for Quality of Life After Stroke, where she'll be able to continue the work of implementing strategic research initiatives to enhance stroke rehabilitation and outcomes well into the future. And Catharine Sparks is a clinical research manager at the University of Utah. She has a background in psychology and many years of research experience in areas of caregiving relationships, health, cognition, and aging. Her work supports researchers like Dr. Terrill in the planning, implementation, and clinical trials designed to improve patient care and meaningfully impact health outcomes. She appreciates the opportunity to continue her commitment to supporting individuals in their care by helping facilitate the RestoreD study for couples coping with stroke and working with couples who agreed to participate in the study. Dr. Terrill and Catharine, I'll turn the time over to you.
All right. Thank you so much for that introduction and for having us here. And we're really excited to share with you about our Restored program. Can you go ahead and move the slide? Okay. Just as a disclosure, this is a study that is funded by the NIH, on which I am the PI. Next slide. So for those of you who are not aware, worldwide, stroke is the third leading cause of disability in the U.S. Nearly 800,000 people have a stroke every year. That translates to every 40 seconds, someone has a stroke in the U.S., which means that most of us are impacted by it either directly or indirectly, and know someone who has had a stroke more than likely. There's a long-term impact on physical mobility. Oh, can you go back?
Sorry.
You're a little fast for me. On physical mobility, things like speech and language, cognition, as well as emotions. Emotions is by far the most under-addressed, but maybe one of the more common factors or remaining impairment after a stroke long term. Now let's move forward. So over a third to half of stroke survivors and their care partners experience depression and or anxiety after the stroke. This often leads to negative effects on recovery, rehabilitation, and quality of life, both for the person who had a stroke, so they're not as able to engage in rehabilitation therapies, for example, which affects things like more disability later on down the road, greater risk of rehospitalization, and greater risk of having another stroke. And for the care partners, it affects their own quality of life, but it also affects the care they're able to provide for the person who had the stroke. So there's kind of the double impact there. And what's really important to know is that research shows that mental health and well-being are interrelated in couples in close relationships. So if one partner is depressed, the other partner is more likely to be depressed as well. And so it's really important to think about this not just as an individual isolated issue, but actually think about treating the couple. And so that's the approach that we have decided to take with our intervention. We're also using the approach of thinking about resilience rather than deficits. So resilience is the ability to bounce back. It helps protect us from anxiety and depression. And the intervention, as we'll show you here in a minute, was specifically designed to promote resilience and well-being for both the partners individually and the relationship. Despite, should have mentioned this earlier, but despite the high prevalence of mental health issues after stroke, both for the person who had the stroke as well as the partner, availability and access to mental health support is extremely limited, particularly evidence-based support and interventions and support that are accessible for those who may not live within close distance to a medical center. It was very, very limited. And so that is something that we wanted to address with this intervention. We designed Restored. It's to address exactly this gap, this need, specifically to promote resilience in these couples. We initially had a pilot study that was funded by the NIH. You can see some of the publications we have from it. Our pilot findings were really promising, showing both increases in resilience as well as decreases in depression for these couples. And that was maintained at 3 months out. We had a bunch of other findings, but really, we're here to tell you about this intervention and kind of where it's going and maybe why this might be a good resource for some of the patients and the families that you might be serving. So right now, we do have an NIH RHAU funded randomized controlled trial. This is an 8-week program. The 8-week program is the actual intervention, active participation. There are assessments at pre, post. There's a 16-week follow-up that's for the randomized waitlist control, and then a 6-month follow-up. All participation is remote, so everything from data collection or initial enrollment, data collection, and the intervention are all remotely administered, and we do provide gift cards. We'll tell you a little bit more about that at the end of this presentation.
All right, I think I'll take over from here. Thanks, Alex. So yeah, as Alex mentioned, the intervention is 8 weeks of active participation for our couples. So I'm just going to tell you a little bit about what that looks like as they're moving through the program. And then I'll tell you more towards the end about how you can get this information out to folks. So the 8-week program is for couples to do together. And each week, couples are introduced to a new topic. The topics listed here include things like goal setting, communication, connecting with each other. These topics were chosen because they're known to support well-being and building resilience after a stroke. Next slide. Couples will be provided with a booklet to help guide them through the topics each week. They'll read about the topic, have access to additional resources related to that week's topic, And then they're encouraged to complete activities, both on their own and as a couple, to apply what they've learned that week. So this is an example page from Module 1 or Week 1 that offers an overview of activity types and what to expect in the coming weeks. Next slide, please. This is another example page and it's from the module on social relationships. But you can see we provide a little bit of research information, and then we list a variety of possible activities that they can choose from. So we've got stuff on here like create a music playlist for each other or learn something new together. And so we do try to provide some various types of activities, everything from something that might take a few minutes to something that might be more in depth, and they can choose what they want to do for the week. Next slide, please. Yeah, so another thing that we do is we send out videos that will introduce the week's topic, and then we've created videos that highlight a particular activity focus for the week. And we'd like to play this video for you. This, I believe, is about gratitude, just so you can kind of see the type of materials that are sent out to our participants.
Let me know if the volume's working when I hit play.
Okay. No.
No. Let's see. Yep. Is this link available on, it doesn't like the share volume on PowerPoints. Do you have this on YouTube or on the website?
I don't have it readily available.
Okay. Sorry,
So,
I didn't realize there was a video on the slide. I should have checked that ahead of time on that.
okay, we can skip it.
Okay. I can send this recording out to the registered attendees as well.
Yeah, no, I can find the link and send it out to you later.
Okay.
Just as good as a video. We'd love to share positive feedback from our participants, and currently we've had over 170 couples go through the program so far with lots of positive feedback, and I'd just like to share some of their comments. So we've got, expressing gratitude really helps me stay more centered on how far I've come instead of focusing on the negative stuff so much. This has helped me see that there are good things in every day, and that I have the power also to create those positive scenarios for myself. I'm not just at the whim of fate. So it was very self-affirming in that way too. Next slide. It helped me realize I could enjoy spending time with my partner, not just someone I take care of. Feels more like what couples would do as opposed to just feeling like I'm a caretaker, which is something that I've struggled with. He was more empathetic, so the study has some real value. Us thinking about it as a couple, not just me in my bubble of strokedom, but as a couple. Really powerful. I'll go over some criteria. So inclusion criteria, when we are enrolling participants, we do a screening process. And one of the criteria is that we find it works best for folks at least 3 months out from their most recent stroke and not more than 3 years out. So that's the window. They must have a romantic partner and be living together to participate. And both partners must be willing to participate. It is definitely something that we encourage them to do together. Currently, Restored is only available in English, although we are actively working on a Spanish version. But for this particular study, they do need to be able to read and follow instructions in English. Oh, not quite yet. Exclusion criteria, significant cognitive impairment. This comes down to basically we need them to provide their own consent. Mild to moderate cognitive impairment or expressive aphasia is fine for this study. Enrollment in other studies is also okay. One caveat that we like to emphasize is that this is not couples therapy. We are not providing any therapy resources. This is just a program that they'll do together. All right, next slide. This is our flyer. So anyone watching this or that will see this later, you'll have access to a PDF copy of this that you can share with anyone that you think might benefit from participating. And all the details are there on the flyer. What folks will do is they'll either follow the URL or scan the QR code to fill out a brief survey online. It's a pre-screen that gets sent to our team. Someone from the team then will contact them and do the screening process. If eligible, the couple will enroll together. Our couples will be assigned to one of two groups. Either they'll start the intervention right away, or they'll be in our control group where they'll wait 8 weeks and then be given the intervention. So all participants, regardless of group assignment, receive the intervention and can participate in the program. Our phone and email are also on that flyer. So if folks just want to call or email with questions, we're available for that as well. Next slide. Actually, go to the next slide and we'll come back to this one. So just as a resource, we've included this at the end of the presentation. It's a list of mental health resources for stroke survivors and caregivers. We just like to make that available for people. All right, you can go back. So yeah, this is our contact information. If you have any questions after this, or if you're seeing it later. Alex, did you want to say anything in particular? There's a link there for the Center for Quality of Life After Stroke.
Yeah, so we have a just very newly approved Center for Quality of Life After Stroke that is housed in the Physical Medicine and Rehabilitation Department at the University of Utah. And so I wanted to provide this link if anyone is interested in checking that out. One of the things I'd really like to do is have rural specific resources available there. You know, it is just starting, so we're kind of got a lot of things in development, but there's a way to kind of keep updated on things that are going on and so on. So if you're interested, please check that out. I also wanted to add to what Catherine has mentioned, just as a FYI for this group. Of the couples that have participated in Restored, over a third are rurally located in the Mountain West region. So, you know, it's mixed, but I think that's a fairly good representation and kind of speaks to that folks in those areas are interested in these kinds of programs.
Excellent. Do we have any questions from the group? Make sure you note down that email for questions, but as Dr. Terrill and Catherine mentioned, these slides, as well as the flyer that was on the slides, are all going to be available with this recording on our website, RHAU.org/RHAU-resource-webinar. So we want to thank Dr. Terrill and Catherine for providing an overview of this amazing program. I really like the Restore D program and what it brings. I think it brings a lot of hope in difficult situations, and appreciate them making themselves available to come and present on this today. And if you have any questions or have a hard time finding the information you're looking for, you can also connect with us at info@RHAU.org, and we'll get you connected with Dr. Terrill and Catherine. We will go ahead and move to our next presentation if there are no further questions. All right. Well, we will turn the time over now to Gladys Chiang with Woodpecker Copilot. Gladys, if you want to bring up your slides. Excellent. And Gladys is the co-founder of Woodpecker Copilot, which is an AI medical scribe and clinician assistant built for good, not just for profit. The company is committed to supporting frontline clinicians and expanding access to compassionate, high-quality care, especially in rural and underserved communities. And Woodpecker Copilot is offered completely free to eligible free and charitable clinics. As a proud graduate of UC Berkeley and UCSF, Gladys's background spans mental health, digital health innovation, health equity work at the intersection of AI and healthcare. Gladys, the time is yours, and we'll go. We have until 12:50, but if you're up a little early, that's fine as well.
All right, thank you. Thank you so much for the warm welcome. I'm very excited to be here, and I'm very grateful to be in front of all of you today. And wow, I learned a ton just now from the speakers before me. So big thanks to Dr. Terrill and Catherine. And I'll do my best to keep the momentum going. So to get started, like Cassie said, my name's Gladys, and I am the co-founder of Woodpecker Copilot. Excited to tell you what we offer and why it matters in your day-to-day work, and what we all want are helpful tools that simplify our lives and don't make it more complicated. So that's why I'm here, to have this conversation today with you to see how Woodpecker Copilot can support you in reaching that goal. And I don't mean to be a Debbie Downer, but this bill did just pass, and you already know what that means. It could lead to a lot of issues when it comes to access, fewer resources, and just makes it a lot harder for us to care for the very patient that we're so focused on serving in every way that we can. It's a lot, but I'm not here to dwell on that. We want to offer tangible support to you and show up for you. So I honestly wouldn't be able to go home tonight without thanking each and every one of you and the effort you put in as healthcare professionals to make sure your patients in rural communities get the high quality care that they deserve. And you're more than clinicians and administrations. You do more than these roles suggest. You're case managers, advocates, translators, IT support, and emotional lifelines. You fill in the gaps that policy doesn't address, and that deserve recognition and support, not just add to your plate. So now, today is about you, and currently the major context we are dealing with is the post-bill reality, and one way we can work on the access gap that exists in a rural setting is through AI tools. But there's so many of them. How do I even choose which one to use and which one to trust? And why does it feel like most AI tools don't really focus on rural communities and rural healthcare? But Woodpecker Copilot is the most prominent AI tool that has come out and say, we care about serving the underserved communities, and we want to help you care for these patients better. This isn't new. One clinician's caring for 5 counties, staff burnout, EHR burnout, and sometimes clinics gets very busy and you only have time for brief visits, much briefer than these patients deserve. And with these challenges don't appear and they grow. They become more urgent and more visible. So we don't want you stretching yourself too thin as you try to meet the demands of your roles. So we want to be more than just a tool that you hear about. We want to be a partner in your journey towards caring for these patients. But what makes a great partner, especially in rural healthcare? I would say some of the most important things are saving you time, being a versatile tool that works in different settings, whether you're working in clinic, whether you're working from home or Zoom sometimes, and something that merges easily with you and your team's workflow, and the kind of partner that really aligns with your value. And that's why we are the only AI medical scribe and assistant that actually starting out of the gate with the mission to provide high quality AI tools that are too often so like these big AI scribe tools too often charge thousands of dollars, but we want to make it so affordable to rural clinics at a fraction of the price. And we charge no fee for free and charitable clinics, and that's our commitment. And you may wonder, why the name Woodpecker Copilot? We actually got that question quite often. So it actually comes from both where we began, Stanford, hence the tree, and also what we stand for. In many cultures, Asian cultures, the woodpecker symbolizes resilience, perseverance, and protection, and it works tirelessly, pecking away at hidden worms until every last one is found, protecting the tree's health, and is even believed to bring good fortune. And that's exactly how we show up in healthcare. And we stand beside clinicians and underserved communities, relentlessly removing the burden that wear them down. And we will keep showing up, pecking away at behind the scenes bugs of healthcare so care can thrive. And we will make noises like Woodpecker do, but people can count on us to take actions because we care. So now that you've heard about what we stand for and why we started in the first place, let me tell you just a brief overview, like a big picture overview of the kind of services that we provide as your AI medical partner. We provide 24/7 AI scribe that work both in Zoom browser in the clinic or on the go on your phone. And we also understand that a lot of patients don't necessarily speak English. So we also provide multilingual support. But one of the most important things is that we're simple to adopt. And I say this over and over again because it's so crucial and important for us that we are easy and smooth when we get adopted into your workflow. So you can imagine that you're literally having a scribe in the room who listens to the patient's-doctor conversation in real time, invisible, right? No other people can see that, but the patient that you inform and so that you actually get the chance to listen to them and don't miss any high yield points during the encounter. And it also generates specialty-specific notes for you and your patients. So this is what Woodpecker is. We generate comprehensive clinical notes for different types of specialty situations in just a minute. So we start with listening in the patient-doctor conversation, and then you will have real-time transcribing, understand that context, extract it, and then generate that notes for you. So yeah, okay, I think that's enough. I think it's time for the fun part, and that's the demo. So let's say we have a family doctor, and let's say it's Dr. Casey. He is a family medicine physician, manage chronic pain, working in a rural Utah clinic. He sees about 18 patients a day, does everything from chronic care to walk-ins to well visits, right? And he got 2 staff, limited IT support, and a Zoom telehealth session coming up. He gets to pick whatever devices that works for him in the setting. It could be laptop, desktop, or your mobile phone. Simply opens the browser, log in, and your AI scribe is right there, ready to go. And here's how simple it is in practice. You log in, select your preferred language, and you opt in a verbal consent. And as you continue to have the conversation, the scribe will transcribe it as you go. And let's just fast forward to the end of the conversation for the time being, right? You finish up the conversation, you tell him about what medication you're going to prescribe, everything, you click generate notes. And within 30 seconds, you get a fully structured, accurate notes with ICD-10 code and a comprehensive summary. Woodpecker contains more than 20 plus specialty trained by our AI engine. So your family physicians, cardiologists, pain medicine, mental health, psychiatrists, you name it. And we have these AI models ready for you, ready to go. Not only do you get your own detailed notes as the clinician, your patient also get a post-visit summary, and that will be in layman's term. You can look it over, approve, and send it over to patients via text or email. And this will help them follow doctor's recommendations, better understand the visit, better experience, as simple as that. And you don't have time to learn a new tool, and that's okay. We made one that doesn't ask you to spend extra time. It's simple and it can automate your documentation process. So with Woodpecker Copilot as your AI medical partner, here's what your life could look like. Your patient receive instructions that are generated and translated from medical terminology into layman's term so that they can actually understand. And it's really important for health literacy, and also to help follow the crucial instruction that you provide. You also get to breathe in between visits, get a little breather in, and free your hands up and allow you to actually get that direct face-to-face time with patients. And you can almost think of it as an extension of you working in the background, allowing you to shine as a star that you are. Then you also have time to be human, to free up time and this cognitive load to restore some of that peace and presence that make you human. So here are some QR codes you can use today. You may already know about Open EMR. It's a go-to EMR for many rural and underserved clinics. It's the largest free and open source platform that can help keep the cost low. And Woodpecker Copilot is already integrated in it for you to use. And plus, we're available right on the Zoom marketplace, so you can add us instantly for your telehealth sessions and start using it right away. Just scan the QR code and the web page will pop up for you to either download the OpenEMR or just add us to your Zoom. So yeah, thank you so much. And I'm happy to chat whenever. The QR code on the screen, feel free to open it up and fill the form. We can just simple steps of your name, contact, specialty, and our team will reach out to you, whether it's to demo this even in details for you, answer any questions you have, discuss like what resources you currently have and how can we meet you where you at. We're happy to chat. Our goal here again is to support rural clinics, underserved clinics. So whatever you need, or just want to chat about like pick each other's brains, brainstorm. I'm always here, and you can always find me on LinkedIn as well. So yeah, thank you.
All right. Do we have any questions from the group? I will just share. I know of one rural provider who's using a similar tool. I don't know if he's using Woodpecker Copilot or if it's just something similar, and noted to me that it was a game changer in his clinic, and that he's actually able to go home at 6 o'clock and go spend time with his family instead of sitting in his office for 2 or 3 hours after he finishes patient visits trying to complete all of his notes. So these are definitely very powerful tools that can help combat burnout, combat errors, and in charting, and help rural providers to thrive without the added burden of all the additional administrative work that they have to do themselves because they lack the administrative staff that larger clinical practices may have. So any other questions before we wrap up? Looks like we'll wrap up a little early today. Well, thank you, Gladys. I'll take over presenting again. Let's see. There we go. Okay. So we'll go ahead and wrap up the session. Thank you to all three of our speakers today. These are definitely great resources, and we appreciate your willingness to present and help support our long-term success as a webinar series. Our next session will take place on Thursday, August 7th at 12 p.m. The August session will feature Intercare Recruitment, who can help place highly trained international nurses in your facility without any extra work to you. We'll also have Cato Supply, who specializes in getting supplies that you need if your typical supplier is not able to get you what you need on time. So they're a great backup to your typical supplier. You can RSVP for this session using the QR code that's on the screen, or by visiting our website, rhau.org/rhau-webinar-series. Additionally, the recordings from today's series will be there on the website as well as the handouts. A note, we are also currently looking for presenters for the end of the year. We have just a couple spots left in 2025 in November and December if you are interested, but we recommend that you hurry because those spots are filling up quickly. And we appreciate everybody's willingness to be here today. Hope you have a great rest of your week, and we'll see you all in August.
Thank you, Casey.